Hello, everyone. Hello. Thank you for joining us. Welcome to this webinar sponsored by the Partnership for Maternal and Child Health of Northern New Jersey. I'm Irina Polanco-Ventura, Director of Public Health Initiatives at the Partnership, and I will be serving as your moderator for today's discussion. We are delighted that you have decided to join us for this webinar entitled Integrating Doulas into the Healthcare Systems, Research, Resources, and Recommendations. And today we will delve into the valuable role of community doulas in healthcare by providing a presentation led by our speaker, followed by a panel discussion. First, we will hear from Jill Wodnick, who will facilitate the first half by sharing a summary of research and work being done around the country regarding the respectful integration of community doulas within the birthing space in the medical setting. And her presentation will then be followed by a panel discussion with Jill and staff from both the Partnership and St. Joseph's Health in Paterson, New Jersey. Towards the end, we will allot some time for a Q&A with the audience. So if you have any questions, please place them in the chat. Lastly, please know that this session will not be offering any continuing education credits. However, it will be recorded so you can pass it along to your colleagues. And without further ado, I'd like to introduce our speaker. So Jill Wodnick is a longtime Lamaze childbirth educator and doula, and she works on high-value maternity care policies at Montclair State University in Montclair, New Jersey. And through partnerships with organizations, she does tremendous work to move this needle forward. She focuses on breastfeeding equity, early relational health, and environmental justice woven into maternal health. Thank you, Jill, for being with us today, and feel free to take it away.
Thank you so much, Irina, and thank you to everyone here. What I'm so excited about is the ability to move from policy into practice, which is what all of the time together really lets us do. So to level set, because I really want to hear directly from the integrative care that's happening currently as we profile and experience with Aurelis and St. Joe's, I want to just level set and share 4 key roles for doulas. If this definition is new for you, you can find the QR code and take a picture of it. And it comes from a confluence of the National Partnership for Women and Families, Health Connect One, Tewa Women United, and the Health Law Center. And it really reinforces the critical role of doulas providing support, education, advocacy, and emotional care and comfort. And I like to just ground us with this information so we're all talking about the same information and the same ways that doulas care for others. So I don't know about you, but I know that there are people here who remember almost 20 years ago exactly. I want you to not only look at the headline, I want you to look at the date. This was January of 2004. The Wall Street Journal wrote, "As doulas enter delivery rooms, conflicts arise." Now, I remember this partly because I have been a doula for about 22 years, and it's been harder for me to do a lot of on-call labor support in the last recent years for some family reasons. But gosh, I was like on call all the time, and I was heading to a birth at St. Clair's, and I saw this because I'm in one of these avid newspaper readers. So I used to subscribe to a lot of newspapers. "As doulas enter delivery rooms, conflicts arise. There's a new workforce entering obstetric wards. They often are strangers to the staff, unrelated to patients. They aren't licensed, and they aren't required to have any formal medical training, and they are sparking protests in the medical community." I sometimes wonder if this is 2024 or 2004 when we saw this. Because if you really read the first paragraph, which is why I'm spending a moment, is that the critique in the first paragraph is the lack of medical training, strangers. And yet I want to go back to the definition. Doulas do not do clinical care. Information, education, advocacy, support, and comfort. And yet, the media was all abuzz about doulas being strangers to the staff and not being healthcare providers. And we're going to continue to sit with this tension 20 years later. Where are we 20 years later? Well, the University of Pennsylvania has a major research grant on the topic that we're talking about today, integrating doulas into hospital maternity care systems. We've all come a long way in terms of building bridges, building trust in maternity care for consumers, and working more collaboratively. So I'm going to encourage you to follow this from University of Pennsylvania, because this conversation that we're having on a state level is being amplified at the national level through UPenn. We know that integrating doulas is a state and federal priority everywhere, from the National Governors Association, who articulate about doulas again and again, and Microsoft, Walmart, and CVS just 2 months ago added a doula benefit for employees. And just this morning, I thought I had my slides sent to Irina, but I woke up, I read my email, and I had to add this one. There's a new partnership for Blue Cross Blue Shield in terms of providing doulas for federal employees. Now, what the last few slides show you is, again, the visibility of businesses and corporations having doulas as an added benefit, but it doesn't really talk about where the rubber hits the road, which is doulas working collaboratively within labor and delivery. And so that's why it's important to have these conversations and go deeper, because 19, now 20 years later, the Wall Street Journal, we wouldn't have been able to even think about this is where we are with the integration of doula care. But I want us to consider this as we're looking at value adds for employees. We know that doulas have historically disrupted ideas about patient autonomy, about shared decision-making. Doulas have historically been volunteers. Some of the strongest community-based doulas in the country started out as volunteer programs. We have an unprecedented interest in integrating doulas as a professional workforce where retention is valued. And yet it's a system that sometimes doulas have been tasked with preventing or even mitigating harm. And there's incentives, there's conflicts, and there's still, as the Wall Street Journal defined 20 years ago, mistrust and distrust. All of these are true, but we can create a new paradigm, and we can do it understanding that we are listening to women and birthing families, that 1 in 5 mothers overall, this past September, 30% Black, Hispanic, multiracial reported mistreatment. 40% of Black, Hispanic, and multiracial mothers reported discrimination during maternity care. And 45% of all mothers reported holding back questions and from discussing concerns with providers. So we need a new paradigm, and conversations like these and all of the events that are happening are making new opportunities available to reimagine high-value maternity care. So I really believe that we are moving for radical collaboration and dynamic disruption, because I still go back to the Wall Street Journal, and I still go back to the interest that consumers, clients, employers, and birthing facilities have with working with doulas. So very quickly, I want to get to how does this happen, but I want to spend a little bit more on the payer side, because sometimes it's the payer side that actually sometimes drives how to get some collaborative practices. Mass Health started covering doulas about 6 weeks ago, and that's a very important landmark for their state Medicaid. In 2023, 5 more states enacted legislation to cover Medicaid for doula services. Really, the iteration comes with the reimbursement rate. And in California this past month, the reimbursement rate went up quite significantly. That's a conversation for a different topic, but I just want to continue to show the expanse and interest in scaling up doulas by showing that Utah has required coverage of doula care for public employees, and that Oregon signed the doula services for women's correctional facilities this past summer. And so with this legislation, we have to wonder, where is the workforce, and what do we do on a local community level to build partnerships with doulas? And the payers are wondering the same thing. The Institute for Medicaid Innovation and Every Mother Counts did an entire learning series on Medicaid and integration of doulas. And I was part of that curriculum team, and everything's free and available online on YouTube and on the website. But for a New Jersey perspective, let's start to get granular. Let's start to get granular actually by looking at some federal reports that I think really can tell the story of integration of doulas in New Jersey. All of these are available. I can list them in the chat, and they're available on the slides after. But this is what I would hope that at some point in 2024, I would challenge all of us to meet in person and to hear what the federal government documented as doula burnout and low workforce retention. And this is a national report that came out about 4 months ago. And when listening to doulas reported 3 major stressors: negative interactions with clinical staff, traumatic births without resources to process them, inadequate childcare for unpredictable and on-call work schedules. And I'm so appreciative that the federal government was able to really define and map out the significance of listening to doulas and being able, as doulas are more and more wanted, but not always given the resources or the infrastructure to handle the workforce retention and to ameliorate burnout. So this is a conversation that I think can be really in the future done in person in New Jersey. So very quickly, let's get to the toolkits, because then I want to really listen and learn from partnerships that are happening locally with strong relational trust. And that's where the rubber hits the road: strong relational trust. So first of all, you can watch an entire presentation done by Boston Medical Center, where the community-based doula is and program there called By My Side Birth Sisters is talking directly with the certified nurse midwife manager. And they have 6 tools for evidence-based implementation. This is a HRSA webinar. Again, it's free, it's on YouTube, it's through HRSA, but it's really centering communities and doulas of color as equal partners in policy and financing decision-making, clarifying the role of doula, acknowledging systematic racism, educating all stakeholders on the role of the doulas, promoting mutual respect between providers and doulas, and creating sustainable models of doula employment. And all of these pillars deserve their own area of focus. I just want to highlight this as a tool to start the conversation happening for building trust for implementation. A toolkit that I encourage you to use immediately if you're working within a hospital facility is from the California Maternal Quality Care Collaborative. This is available, and what I appreciate about this toolkit is that they have administrative strategies, they have clinical strategies, and they have educational strategies on integrating doulas into the birth care team. And so in some ways, right, this work is kind of mapped out for us, and now we can do the relational work. So this comes from CMQCC. You see their logo on top. And they really kind of go into the iteration about the role of teaching, comfort, advocacy, postpartum support, and that continuity to continuous-based care, but not doing clinical assessment, not making decisions for a patient, not leaving a patient alone during labor, and not diagnosing. But their toolkit actually can become even more specific, because they remind us within hospital facilities, doulas at your facility are empowered to remain independent champions for your patients. Doulas are not visitors, but are really part of that care team. And so sometimes that's where the distinction happens. Update your policies. Create a culture that values physiologic birth. Connect to community-based doula programs and welcome community-based doulas at your facility. And this one, which is happening today, the bottom check, creating opportunities for interprofessional education. So we have some of these things already written down, and we're starting to see them be enacted in New Jersey. But I have to say, we do need more research and we do need more opportunities to hear each other. The New York City Department of Health is also focusing on expanding the doula workforce. This is long. I'll put it in the chat afterwards. But the final thing I want to tell you is the State of Doula Care in New York City 2023 really focuses on their goal for not just the city, but for New York, which is creating a doula-friendly hospital. And that has criteria and how this would be met and who are the stakeholders, right? Which is everybody in New York State, from Medicaid recipients, community-based workforce groups, to hospitals, DOH, academia, all of them. And finally, this is hard to see on Zoom, but again, I'll put it in the chat. This is the doula friendliness capacity assessment. This is what New York City will be using and then scaling up, which is a way for hospitals to have, what is our ability? What's our capacity to be a doula-friendly facility? Are we at basic, moderate, or robust? Everything from increasing awareness, policies about labor in general, policies about doula presence. I know I'm going fast, but I just want to really, the document will, you can read it. And so be on the lookout for this, because doula-friendly hospitals are a criteria that New York State's going to be using through a learning collaborative. And it might be something that we in New Jersey do formally or informally in terms of thinking about how we can reduce turnover, reduce burnout, and increase the doula ability to want to retain and remain doing labor support. We have so much work to do, but I really believe that even though there is historical mistrust and distrust, we really can move to interprofessional collaborative relationship where trust is happening. Because on the federal level, there's more and more interest about workforce development about doulas from both Democrats and Republicans, bipartisan bills that want to invest in doula care. And doulas know that simple does not mean easy, but we can come with radical collaboration and really hear each other. My final request is that you read the Time study done a few months ago that documents that community-based doulas in California on average spend 32 hours prenatally before they do labor and birth support. The trusting relationship is happening didactically between doulas and families. And now we can work on changing the dynamics for high-value maternity care so it happens locally at every birthing facility for every family. So thank you so much. I'm going to stop sharing and really excited to listen and learn from policy, what I was talking about, into practice, where we are having these collaborations happen. So I am going to, did I stop my share? Stop. I'm not sure if I stopped my share.
I can still see it, Jill. Perfect. Okay, I think now we're good.
Great.
Wonderful. Thank you so much, Jill, as always, for your insightful presentation. Building the doula workforce, creating respectful policies, developing a strong and fair reimbursement model, et cetera, should be on the forefront of all maternity care conversations around the country. So thank you for your work, for always making an impact and keeping us informed. Most of all, thank you. So now we will move on to the Q&A session of the program. And first, I want to thank our panelists for being here. So I will go ahead and ask everyone to introduce themselves. And Aurelis, do you mind kind of starting us off?
Not at all. Hello, everyone. My name is Aurelis Martinez. I am part of the partnership team. I am the supervisor for the Greater Newark and the Patterson Community Doula programs. And I am excited to be here in this space and share exactly what the effort we put in with St. Joseph to make exactly what Jill was speaking about coming to life. And we're still in progress with it.
Perfect. Thank you so much. Debbie?
Hi, I'm Debbie Katz. I'm the manager of the nurse midwifery service at St. Joseph's. I've been a midwife since 95, and I've been at St. Joseph's since 2013. So we've integrated centering pregnancy into our childbirth model here at St. Joseph's. And now Carla and I, who you'll learn from next, are integrating doulas into St. Joseph's. We've gotten funding for 6 doulas, and we're in the process of hiring them.
Thank you, Debbie. So happy you're here. And Carla, I see you on.
Thank you so much. My name is Carla Rizzo. I am a nurse practitioner. I work at St. Joe's. I've been there for 24 years, and I'm the manager of the outpatient OBGYN services. And here's a shameless plug. St. Joe's is hiring 6 full-time doulas. We're incorporating the role of the community doula into our service, and we hope to put all of the great policies and practices that Jill was just speaking about. I took a lot of notes because, full transparency, it's a pilot program and we're just getting started. So we're super excited to be here and talk about our successes and my struggles. Thanks, everybody.
Thank you so much, everyone, and we appreciate your time. So I'm just going to go and ask kind of a few questions to the group. Jill, please feel free to chime in as well. And then if we have some time, I'll take some questions from the audience. But just a reminder that we plan to end at 2:45, and we want to be respectful of that time. So Aurelis, I'm not picking on you, but I will start with you first, if that's okay. So about 3 years ago, the partnership partnered with Health Connect One, New Destiny Family Success Center, and St. Joseph's to create the Community of Caring Doula program for Patterson families. And this was funded by the Burke and Taub Foundation and Terrell Fund. So Aurelis, would you mind starting us off by sharing a little bit about the Community of Caring Doula program at the partnership?
Irina wants to pick on me. I'm just kidding. Of course, I am so honored to sit in this space and share how we got it started. I will start by saying that the number one piece was connecting with the community, right? That is the number one priority. How can we serve our community without the input of the community? So we wanted to make sure that when we connected with the community to recruit individuals that wanted to participate in the training, that they reflect exactly what the birthing individuals look like, what they sound like, how they're living in our community, of course, right? So that speaks about their languages. We have a huge Arabic speaking population, Spanish speaking population, Bengali. So we just wanted to make sure that the group reflected exactly what our birthing individuals look like in the community. And then once we recruited everyone and everyone was committed to it, we wanted to make sure that we built this relationship with St. Joe's because, of course, that is our community hospital. This is our birthing hospital who is providing the healthcare services to our birthing individuals. So we knew that that was the next piece that had to be a strong relationship. And we knew that we will also need their support for the trainees to complete their clinical requirements, right? And what better way to get this relationship started than to do it while they're in training, to allow them to have this opportunity to have the experience, build the relationship, learn from them, and kind of just know the feeling of the hospital setting. And then once training them, of course, having them the ability to come into the hospital and actually support births, and actually engage with the midwives and with the clinicians, with the nurses and the OBs, and just making sure that they are all there to meet that one priority, which is making sure that that birthing individual has a healthy birth outcome. That's our number one priority. And then, of course, New Destiny Family Success Center, they are our go-to when it comes to community resources, right? We know that the reality of it is that our community have many stressors that we need a lot of support with. And as we always say, it takes a village, right? So if we want to make sure that we are helping this birthing individual, there are some stressors, maybe housing, maybe employment, maybe financial support that they may need. So connecting with the Family Success Center was another priority for us because we knew that they have most of the resources that we like to connect the families to. So that was a really great learning experience. We are still going with them and really happy to be in that space with them. We did train 13 community members, and of the 13, 2 were hired at the partnership. But we continue to support the other community doulas, of course, with becoming Medicaid providers, with making sure that we continue to educate them and provide resources for them so that they can also be beneficial to the community members as well. It's not just focusing on the ones that we were able to hire, but making sure that the entire group have access to all of the benefits, if that makes sense. And I think I cover it all for the most part, like summed it up.
No, thank you. Beautifully, thank you. So my next question is for either Debbie or Carla. So, hearing Aurelis and hearing, how the partnership has evolved over the past few years, in your experience working with the Community of Caring program, how has integrating community doulas benefited the medical providers, and how has it enhanced the overall patient experience in a hospital such as St. Joseph's?
Hi. So, so we had the doulas, during their training portion, meet clients at our clinic through our centering pregnancy program. We had them, do their, required deliveries, attend C-sections, at our hospital. Every experience was a beneficial experience. Every time they were with clients was a positive experience. We had no negative experience, no negative outcomes. Even when a patient, patient's experience ended with a C-section, it still wasn't a negative outcome. It was a satisfactory experience having had that support. So, we look forward to continuing seeing the doulas from the partnership come to our hospital. In fact, today in one of our centering groups, there was a partnership doula present. So I'm glad they're still here and still seeing patients, and, integrating into our care.
Thank you for that. Thank you. Debbie, one of the things that Jill mentioned during her presentation was doula policies. And I know that that's something that we worked on at the very beginning. So you and your team, and Carla, please feel free to jump in. You and your team developed a doula policy for St. Joseph's, very centered on collaboration. Can you share some insights and key considerations that your staff considered when creating the policy? How do you make a doula? How did you end up making that doula-friendly policy for the hospital?
Well, it's the right of any patient to have a doula with them. Whether it be provided by the hospital or if they're bringing in their own. And during the pandemic, which is when we were going about making these plans and policies, that this, really came to a head with the limited number of visitors, that you can only have one person with you. That one person didn't include the doula. The doula is separate from that one person. Knowing what we know here at St. Joseph, that the doula is, an important member of the team. And that's what we're trying to move forward with, it being a collaboration, having them, have full, access to the delivery room, the postpartum care. It was just important for us as well as for the patient. It wasn't anything that we really even had to think about. It just happened.
And the only thing I'll add to what Debbie said is that I think it comes from the support that we have from administration, from the CEO down to our chairperson, down to our staff, physicians and nurses. And that's how we really plan to roll out our program to offer the doula services to all the patients. They're going to be an integral part of our team. It's not going to be a scenario of the patient and the doula against the healthcare team. They're going to be one of us. They're going to come to our department meetings. We're going to have regular feedback meetings with them. And they're going to be included in decisions where appropriate. And, you know, we really have the support. So I think that helps to kind of ease the transition from maybe the doula coming in just to support a laboring patient, whereas now they will be there to support all laboring patients, if, you know, desired.
Thank you, Carla, for that. Thank you, Debbie. This question, I mean, I can pose it to Jill or Alice, but really anyone can jump in. You know, it on the surface, it seems like a very seamless, you know, partnership. And to the point of both Debbie and Carla, because of the support that we have received from our funders, from community members, from the administration at the hospital. But the reality is that there are challenges and resistance sometimes. So from your perspective, from different, you know, perspectives, can you share some of the challenges or resistance that occurs when trying to integrate community doula care services into a hospital's healthcare model? And how are we working to overcoming these?
Well, I want to just jump in because there's people who are on the call that are the reason why I believe not only Debbie, Carla, Aurelis are working with trust is because of legacy from 25, 30 years ago. The community doula program of Patterson in the late 90s set seeds that have birthed this today. There, you know, I know Deborah's on the call, Marie Hogarty's here. There's doulas named and unnamed who have always been in Patterson, and who have been deeply committed to community doula care and doulas for all of New Jersey. But in terms of the making it systematic, I remember what that California toolkit said, which is create a culture that values physiologic birth. And we just heard that. I mean, what Debbie just said as the midwife, so just unselfconsciously, I think is not always what doulas experience in other facilities. So there is the historical legacy and impact that people, organizations, community have wanted doulas and have been and have had to have the tenderness of doula programs not continuing to see this flourish now. And be so well embraced. And the experience that this is a culture that values physiologic birth with every person who's holding that so sincerely, that to me is that's the secret sauce of relational trust that I think a lot of other doulas, you know, who've written in the chat are not always experiencing at other birthing facilities in our state. And so the relationships at St. Joe's and the partnerships give such a meaningful way of building trust for families and for the doula workforce and for the employees of the healthcare system.
Thank you for that, Jill. And I think, you know, that's exactly what we're trying to showcase here is that it is doable and there are steps that you can take. And it's never going to be perfect or very easy, you know, way of doing things. But if we do it in an organized fashion with community voices, with trusted partners, with supportive administrators at the hospital level, it is doable. And of course, always being open to pivoting and changing when things are not working and what we need to do to make it work, and always listening and to the community and putting their voices centered. So thank you so much for that. Aurelis, do you have anything to add when it comes to maybe like some of the challenges that have presented or can present themselves when conducting a community doula program?
Yes, I would add on to the building trust that Jill spoke about. I think that when we think about the healthcare staff, and then we think about doulas, right? They each have their own perceptions of one another. So I know the medical staff, I've heard I've often heard them say, oh, doulas like to come in this space and just want to take over the space, right? And I know the doulas often feel like, oh, the medical staff just don't want to hear the moms. They just don't want to hear us, right? So kind of breaking those stigmas, right? And kind of like coming together. So it does often feels like, oh, I'm in their space. How do I kind of break the ice? But I think speaking to the doulas and just reminding them at the end of it all, our main focus should be, how do we support this birth in person, right? How do we keep our personal feelings about the healthcare system, and how do they keep their personal feelings towards doulas away? And I think addressing those uncomfortable and having those uncomfortable conversations is important, right? And just transitioning those conversations. I know oftentimes we may have conversations with the higher up, but then when you get into the space, it's like the nurses are like, wait, who are you? And what is a doula again? So then you're sitting there thinking often like, we just had this huge meeting with your administrative team and you don't know what's going on. So I know oftentimes hospitals face those challenges. So I think that plays a huge part, that building trust and that communication, just making sure that that's strong to stay on the same page.
To add on to that, Carla and I, the goal here is to make doula a normal part of the team, that everyone, they're going to know our doulas, they're going to expect them to be at births, and it's not going to be a challenge. On one of the interviews I had today, there was, we were talking about birth plans, and how a lot of times when you come into the hospital with a birth plan, everyone's like, oh no, a birth plan. But the thing is, almost everything on the birth plan is what we normally do. Delayed cord clamping and skin to skin the first hour of life, and no routine episiotomies, and, allowing movement in labor. So, we're going to encourage the birth plan. We're going to, everyone knows where we're starting at, and this is what we want. And as long as everyone's reasonable, when this happens, then this happens. It's just, we want this to work, and we're willing to, go out on the line. And luckily we have funders. You mentioned Burke earlier. Burke is helping us fund this, as well as Bristol Myers Squibb, and the hospital has stake in it as well. Eventually, we're hoping that we do get Medicaid monies from the doulas, but a very large portion of our population does not have Medicaid. We have charity care, and we're going to be eating the cost of the doula, but we just think it's important for everybody, and to have that available as a resource.
Thank you for that, Debbie. Thank you, Aurelis. Jill, I'm just going to pivot back to you because of some questions in the chat. That's okay. There's a question about continuity of policy, and I see that Dr. Campbell also shared a comment. So the question in the chat is, how do we create policy continuity among staff in the same facility? She says, I've had vastly different experiences at the same facility and even during the same birth. For instance, second shift nurse required doula, said signed, I guess, page 5, or there was a doula document she had to sign, whereas the first shift nurse offered collaborative care. Then Dr. Campbell also notes, along the lines of policy continuity, so the same topic, I was surprised to learn that some practices state they don't work with doulas. How do we make sure that people across the state are on the same page?
Well, I actually want to defer this back to actually hear from, I want to hear from Carla and Debbie, their response. But from a policy perspective, I can tell you that a law was passed 3 weeks ago with the goal in New Jersey to ensure that some of those structural obstacles will be alleviated. That as of like January 2024, because it went into effect immediately, every consumer in New Jersey who wants a doula can have a doula at their birth facility. This is not about payment mechanism. This is just about the presence of a doula. And what's also written in that law is that every birthing facility has to start to meet the doulas. Whether, again, we're talking about more rural areas like Salem County or Sussex County, or versus Essex County, which has, more birthing facilities. What that law says is that every birthing facility has to work with, in some capacity, collaborate with doulas to try and prevent these haphazard inconsistencies, which really impact patients and families. So that's on a macro level, but like, I would actually love to hear from the three of you in terms of like handling that interpersonally, if it's at the same facility, the best ways of like, what can doulas do when they're getting this inconsistent response shift to shift?
I think communication is the key, and the ability to have a conversation with the nursing staff. I mean, St. Joe's is taking a big, I would say, step in saying that, all of our outpatient clinics as well as hospital faculty practices, those patients the services of a doula will be offered to those patients. And I feel like having the presence of the doula there, and that becoming the norm as opposed to the exception, will help to integrate the role from, just that service being available to select group. I don't think, I'm not going to say that it will be, oh, it's going to be a smooth, seamless transition. I'm sure there will be some bumps along the way, but the ability to have a conversation, OB in general is a small area, right? In any healthcare system, no matter how many deliveries you do, it's usually a smaller part of each hospital. And providers, the nurses, the techs, we have worked together for a long time, and it's usually a group that knows each other very well. So I feel like having or knowing how to have a conversation away outside of the patient's ears is a huge, it's an important aspect of incorporating the care of the doulas. And Debbie and I did hear at different events that, some doulas on the private sector were welcomed in the birthing space, and others, it was same thing, sign this, photo release, they made it very like an adversarial relationship. And all I can say, speaking for St. Joe's, is that, we're doing our best to remove those barriers.
Thank you, Carla. Do you want to take a moment to go into kind of the innovations that are going on at St. Joseph's Health with the hiring of the doulas? Do you want to take some time to talk a little bit more about that?
Sure. So we're proposing a 6-member group for doulas that will offer 24-hour inpatient support for moms in labor. The call schedule or the work schedule will be a 40-hour work week, and it's not set in stone yet what that work week will look like. Our chairman was thinking a 24-hour inpatient call and 2 8-hour shifts in the outpatient department. But Debbie and I know that if you've not worked in healthcare before, going from maybe working an 8-hour day to all of a sudden being on call for 24 hours could be a little bit overwhelming. So we're proposing maybe 2 12-hour shifts inpatient side, and then 2 8-hour shifts. And then the call will, the schedule will be 24/7. So it will rotate. It will include nights and weekends and holidays. And our job comes with benefits, health insurance, dental, vision, as well as paid time off, education days. So it is, a truly, you'll have all the benefits that a full-time position affords you. But we're looking to provide patients with support not only in labor, but also on the postpartum side for breastfeeding, connecting our patients with the right resources for transitioning, from home to hospital to home. And then on the outpatient side, the doulas will be present in our centering groups, in clinic, meeting our clients, so that when they do go into labor, hopefully they'll see a familiar face. And I'd be happy to provide you, Irina, with the link, as I said, shameless plug for our job description. And we have 6 positions opening, and we're currently interviewing right now.
Perfect, absolutely. I'd be happy to share that. Thank you so much, Carla. So we unfortunately are at the top of the hour, but does anyone have any last words, any last comments, anything that you would like to share before we end?
Well, again, I hope that just the gratitude that everyone can really see each other who has shown up. There are nurse managers that are here. I mean, there's so many people here in New Jersey that have made this collaboration sincere, authentic, trusting, that go back decades and decades. So I was delighted to see the people that have called in as participants in the community of care that got to this moment.
Thank you.
And I would like to, as usual, publicly thank St. Joe's for their continuing support. I love it when you can easily identify that's one of the partnership's doulas. So I love that collaboration, and I would just say to everyone else on the Zoom that if you're not on board, that you should definitely jump on board, because our birthing individuals are our most important priority here. Thank you.
And we want to continue our relationship with the partnership. Moving forward, I'm thinking your doulas, our doulas, having continuing ed programs together. So.
Count on that, Debbie, absolutely. And Carla, anything else you'd like to share?
Well, I'm just appreciative of the opportunity to be with you guys today.
Thank you so much. Thank you, everyone. So as mentioned, we have come to the end of the program, and we sincerely appreciate the time that you have spent with us today. We hope that you have found this informative. And please, if you'd like to connect with us, visit our website, www.pmch.org. And also, if you want to contact the doula program, just send an email to doula@pmch.org. Thank you so much, everyone, and have a wonderful rest of the day. Thank you.